So Biden outlines health IT funding priorities. Always a good topic for us. The Biden administration this past Friday released a letter outlining President Joe Biden's request for fiscal year 2022 discretionary funding in advance of Congress's annual appropriations and budget process. The consequences, anyway, they go on to talk about some stuff. I'll skip that and just get down to what they are. The additional funding would go towards modernizing public health, data collection nationwide, in addition to supporting core public health capacity improvements in states and territories, training new epidemiologists and other public health experts, and building international capacity to detect, prepare for, and respond to emerging global threats, according to the letter. So let me give you some of the numbers. 153 million would go towards the CDC's Social Determinants of Health program to support the states and territories in improving health equity and data collection for vulnerable populations. 6.5 billion would go towards Advanced Research Projects Agency, ARPA, for health, a new agency, ARPA for health, aimed at driving transformative innovation in health research and speeding implementation of health breakthroughs. In addition, the request would provide 65 million to 2021 enacted level of rural e-connectivity program, Reconnect, for rural broadband, which we have talked about. The wish list also includes 39 million for advanced communication research at a National Telecommunications and Information Administration, which would support the development and deployment of broadband and 5G technologies by identifying innovative approaches to spectrum sharing. Interesting.
Sounds infrastructure-y to me.
Billion would go towards expanding scientific and technology research. 2.1 billion for cybersecurity and infrastructure security agency. 20 million for new cyber response and recovery fund. 500 million for technology modernization fund. And let's see, 4.8 billion for VA. 2.7 billion of which 2.7 billion is going to the modernization of the electronic health record for the VA.
Yeah.
I think that
Cerner upgrade.
Yeah, I think that's that covers the majority of what's in there. I mean, what are your thoughts? You're a fan of the president, so I assume that you're going to support most of these initiatives, right?
I have to dig into them too and kind of see, what the story is. But I mean, a lot of these things sound very infrastructure improvement, preparing for the future, rural broadband. The VA EMR upgrade, I think, is going to be one of those things that we're going to see go round and round and round, because there's this is a take out an EHR that is a legacy EHR that's working and put in Cerner, and that project seems to be struggling. We see regularly stops and starts and reboots and change of venues.
How many projects do you know that didn't struggle, that would wither under this kind of scrutiny?
Especially, that size of a deployment, right? I mean, I deployed the first 2 different generations of electronic health records in the Department of Defense, and it's it's healthcare. It's super complicated, and it's inside the federal government, which makes it even more complicated, filled with lots of additional regulations and like you said, oversight and politics around, the whole procurement process and all of that too. So it is very complicated. I know it's not going to be easy to do, but yeah, I think continuing to make, good investments in public health. Several of the items you read off were sort of public health modernization, which we sort of figured out over the course of the pandemic, especially in the early stages. Tons and tons of problems with public health and the lack of investment at the local and state level over the past several years. And, maybe we'll be able to catch up. But to your point, this isn't about just catching up and, in other conversations that you and I have had, this isn't about necessarily just catching up and building the things that we use today. This is about spending that money to build the things that we want to be in the future. And we really have to sort of keep that in mind, because if we just build stuff that we already have, then we're not spending the money well.